All right, let's go to the next couple of articles. Kevin, I'm going to kick this one over to you because it's about red light therapy. This article is called "The Latest in Red Light Therapy" by Dr. Zung Tran. This article reviews the rapidly growing evidence around repeated low-level red light therapy as a novel intervention for myopia control. And red light therapy, ever since like we first heard about it, has been this like really headline-setting topic because of, what kind of results they've got in from it, and then there's been some controversial elements around it. So, what can you tell us about this article?
Yeah, so Matthew, so this article is written in Australia as well. I don't believe they have access to red light therapy yet, but there's been a lot of circulating evidence showing that it's been used in Asia and some Southeast Asian country. So what in this article, what the author has tried to deliver is to try to investigate what kind of treatment effect can be delivered by the red light, low-level red light therapy. And specifically, the author have pointed out a couple randomized clinical trial, one of which actually shows that over 69% of those patients have shown reduction of axial length elongation with the use of RLRL in a 12-month period. And specifically, they also look into some sort of ocular changes and what kind of refractive error nuances that has been shown based on current clinical trial. And what they found was not only does this slow down the axial elongation, but some study actually found that some individuals have shortened the axial length by more than 0.3 millimeter changes and with a slight hyperopic shift in the refractive error. But those individuals are mostly have moderate to high myopia changes. And
Hmm.
I'm very intrigued, specifically when the author have touched upon the pathophysiology of how RLRL actually work and interact with the eye. Because, when I first touch upon this subject, to be honest, I'm not really comfortable with the idea of putting laser on a fragile young eyes. That is
Right.
kind of scary and kind of like skeptical to me. But the more I read about it, study have actually found there's some scientific basis on that. Specifically, the RRL have shown to enhance the choroidal blood perfusion or circulation, which seems to be able to slow down or reduce the scleral hypoxia. When we have scleral hypoxia taking place, the scleral collagen tend to strengthen a little more over time, but there's been some studies showing that there's an age-dependent response. The younger the kids are, obviously the sclera will be more fragile, more malleable, and chances are they will be progressing no matter what we do. Versus young adult, when they get to teenager or young adulthood, the sclera tend to mature a little bit more and more. So that tells me that the RRL may be more catered towards the teenage and young adulthood more likely, more effectively. And more importantly, this article have also comment on an aspect of like what would if we combine the treatment together. For example, if we can combine red light therapy specifically with some type of myopia control spectacle or soft contact lenses with multifocal design. What could be the outcome possibly? And the author actually found that is very fascinating and not every combination therapy work equally and efficaciously. And specifically, when they found the axial length changes for those patients undergoing combined therapy between with RRL and the dim spectacle lenses, they found there's a bit more clinical efficacy compared to many other combination therapy. So I found it very fascinating. And but at the same time, I think as a clinician, I still try to put a caveat that not every kid should be considered red light therapy, and there's a I think the next article would be touch upon the potential safety concern about why this matter,
Yeah.
despite all the robust data showing RRL actually works for patients.
Yeah, let's go into the next article. A wake-up call, regulatory changes for red light therapy in China, and this was written by Dwight Ackerman. So yeah, just go right into that one as well.
Yeah, so I think the reason why Dwight have touched upon this article is, just like how I put it, whenever we have the new technology available in the market, there's a viral feed, there's a frenzy about talking about this, how can we can implement it for our patient. Obviously, we put patient the first, that's great. But at the same time, I think as a clinician, we need to be able to stay cautious and be skeptical, I put it optimistically skeptical about each type of new technology, no matter how simple they are. Specifically this author by Ya Xing Wang, this research group have found that they're actually all ophthalmologists in China in different provinces, and they collectively found that RLRL, even though they have posed their own clinical efficacy, for children with myopia. And back in 2022, I believe, they actually launched this technology in the market as a class two device. What that means is that, class two device doesn't have to go through a lot of vigorous or extensive clinical trial or approval in order to being launched in the market. That's pretty easy to do. But starting in 2023, there's a regulation called the NMPA. They actually try to reclassify this type of RRL device as a class three instead of class two. What it means is that class three device tend to have a bit more stringent and more vigorous regulatory oversight for that type of product. So going forward, I think in summer 2024, RRL device, when they have no class device approval, they cannot be launched in the market in China. So that actually is a good and bad, double-edged sword. On one hand, it seems like we're taking away the new technology back on square one, and we have to start from scratch. But at the same time, I think we have to also be concerned about the moral and ethical dilemma, about how can we draw the balance between, on one hand, we can advance the medical innovation, for a patient, but at the same time, we also need to ensure there's enough, safety data to support, for our patient safety. So I think this article is really well written, and it's kind of summarize the pros and cons, what kind of caveat we need to be concerned about. It's not a one side, sweet and rosy picture for everyone, but we do need to kind of be cautious and be mindful about what is out there and how we can utilize those products, responsibly.
Right. Yeah. And let me kick this over to both of you. So, Ashley, feel free to jump in as well, because I'm always curious about what it's going to take for red light therapy to come to the United States, assuming that everything can get buttoned up about, the safety and approval of the technology. And what would it take for it to be brought into your practice specifically, or maybe generally speaking, the average practice in the United States? Like, what would that look like? What would it take?
I have a really hard time with this technology. As much as I read about it, as much as I see that there are studies that support its safety and efficacy, but more so safety, it's still, like Kevin alluded to in the beginning, it just doesn't seem like a good idea. I know it is a shortcut to outdoor time, and I know that outdoor time isn't always a feasible option for families, but I just think we have better options that are safer, that are have much more time behind it's the safety profile here. So I don't know what it would take, Matthew. It would have to take a lot. And
Yeah.
the trial behind taking it a lot just seems dangerous for the children that are getting, the placebo or I mean, I don't know. This does not seem ethical to me personally.
Yeah. Kevin, do you agree with that?
I think the controversy is also about like if it takes so much time for even a matter of spectacle to be approved.
Exactly.
Hey, let alone as a laser, with a strong like, energy level, for the macula, for the fovea. And I probably many of you have already seen, some case reports showing that there's some cases showing the maculopathy resulting from
hmm
RRL, even though they're reversible. But still, it's a really risky concern. We don't want to take a chance, and a lot of litigation would come follow us. If it doesn't go well.
Yeah. Yeah. I mean, you both are making great points. And Ashley, just something you said about a shortcut to outdoor time. And it's like the practice I grew up in, we don't want a shortcut outdoor time. Like there's so much value in outdoor
Mhm.
time. And I really think that like I find it difficult to see a place for red light therapy in the American market in here in the United States.
Mhm.
If you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. You can do so on our Substack, myopiamindset.substack.com. I'll see you at the next one.